Autism Research with Dr. Yusuf and Medical Research on Autism. She's in Naperville, Illinois. She has 1,500 cases away, I'm told, from all over the world. I went over there and I said, how many cases do you need for research? She said 10. I said, send me 10 free of charge. So here we have some results on 10, 11 cases. This is August 13th, and I'm interviewing Mrs. Sullivan here, who is the mother of Ty and Max. And they're the beginning of an autistic research program that I think is going to be substantially informative to the world. So we're going to ask Mrs. Sullivan about her two children and the response that we got so far. And both, I'd like to have it be noted that we use the NUCCA technique, and we use only one adjustment on both these cases. Now we'll talk about Max first, because Max has been here since 4/16/08, and now remember it's only 8/13/08. So Mrs. Sullivan, can you tell me about the progress that we've made with your son?
I'd say I started to notice changes actually right away. Max was kind of a quick responder, so the first day I saw a lot of red cheeks and blood flow, pretty hot that day. The next morning he actually took off his glasses that he had been wearing for about 6 months. He took them off and didn't want to wear them again. So we actually took him back to his developmental optometrist, and she reevaluated him and said that he didn't need to wear glasses any longer. I'd say also about 2 days after his adjustment, he lost a lot of his sound sensitivities. Sensitive to loud noises. He also lost, hey honey, don't goof off. They love the camera.
All right.
And he lost tactile sensitivities in his hands to touch. Since then we've just seen continued motor coordination, bilateral integration, able to ride in a two-wheeled scooter, learn to swim, that sort of thing.
Well, basically now he doesn't need glasses anymore,
Mm-hmm.
and you say he's doing really well. He has better muscle coordination,
Mm-hmm.
less head tilt, and better motor function. No seizures. He had some seizures then, and although he had some gum work done, he had less swollen lymph glands in his neck. But most, so otherwise, it's only one adjustment 4 months later, and he's doing remarkably well. No, you've never seen any autistic child respond like this before, have you?
I don't know. I only know my two kids, but yeah, we've done a lot of interventions in the past 3 years, and
But
it was like an.
You're very, very happy with
overnight,
his response with one adjustment so far.
Yeah, it was really just an overnight response.
All right, now let's talk about Ty. Now Ty, we adjusted Ty a month and a half ago, and one adjustment only, and at that time, I think you told me you were standing on his head for an hour or 2 hours to get rid of headaches.
Yeah, he was complaining a lot of headaches, and so he'd actually end up doing a headstand or standing on his head on the couch, sometimes for up to 3 hours a day, just to get rid of the head pain.
And now he doesn't have any head pain?
No, he doesn't do any of the headstanding
And
anymore.
what else have you noticed in him?
Well, he's also had a lot of gastrointestinal problems, so trouble digesting food, responding to any sort of new food with diarrhea, muscle pain, seeking belly pressure, always wanting to press on his belly, and we just haven't had any of that.
And today you said no headaches, and he has no GI problems, the volume of his voice is better, and his speech is improved, and better eye contact. And for one adjustment, and being what we call autistic children, which I think is a catch-all phrase for any child is not perfectly normal. And we're starting a new research program, and you are the beginning of it, and we expect tremendous results, and we're going to proceed with the efforts that we've done for us with the NUCCA technique. And we thank you very, very, very much.
Okay, thank you.
These are two brothers, autism, all right? Max, 6 years old, autism, initial adjustment 4/16, and still holding adjustment 2/19. Actually now, here we are at 5, this what? May 10th, May 9th, 2009. I saw him about a month ago. He's still holding his first adjustment. And 2 weeks after I adjusted him, he was wearing glasses. Within 2 weeks' time, he had his eyes re-examined. He didn't need glasses anymore. And he's come along fine. He's still holding his first adjustment. And that's a year and 2 months, still holding his first adjustment. And it's very simple. He hasn't hit his head. He's a well-behaved boy. He had an atlas right of 1 3/4 degrees. He came down to 1/4. That's his x-rays. That's his vertexes. His went posterior 3/4 degrees, came down to 1/4 of a degree. Remember, everything we do is based on x-rays. His brother, 4-year-old boy, and he lost adjustment once recently, but still, when he's holding his, wait a minute, initially he was standing on top of his head for an hour, 3 hours a day to get rid of headaches. Remember, a 4-year-old boy standing on top of his head for an hour, 3 hours a day to get rid of headaches. After his initial adjustment, that procedure stopped. He didn't have to do that anymore. All right, his x-rays had an atlas laterality 1 3/4 degrees, came down to 0. Pre and post x-rays. They were acting like perfect gentlemen. We were able to x-ray them very nicely. That's our problem with the autistic children. Well, they hold still for x-rays. These two brothers did a fantastic job. On the Vertex films, it was right posterior 3 degrees, came down to 1/2 degree rotation. The transverse plane. Now, there's a couple of other autistic children. It's a reading instructor. I just had the most amazing session with Killy. I think that adjustment did something, as I am seeing the same effect with Sam. Killy's time and coordination of his visit with effect and facial expressions are matching up. He is checking in and timing his gaze with me. Remember, these are autistic children. All right, two of them anyway. A reading therapist comment too. He read a really fun story with a lot of emotion and got to be the teacher every other page and asked me questions. He loved that. He worked a solid hour and a half with 1 bathroom break. He was so regulated, answered the questions to the story. Everything was so connected and integrated. Read a cool information story about raccoons. You realize that this is an autistic child is making progress since I adjusted him? Unbelievable. This is what the brain can do. A person in charge of this at the other end, working with Dr. Usman, stated that 9 out of 10 of these children had traumatic birth deliveries. Now, in autism, there's an ATEC chart that we use. There's about 80 or 90 questions that the mothers or fathers filled out. We use this on 10 cases. It's speech, social, sensory, health, physical. That is the questionnaire we used. All right. ATEC course is for autistic study. Autistic treatment evaluation checklist. The higher the subscale and total scores, the more impaired is the subject. Speech, language, and communication. Social ability, sensory and cognitive awareness, health and physical behavior. Those are the 4 elements that come from these charts. Age 8, Dr. uses the patient for 3 years. He's better in school, doing spectacular, calmer, less eye blinking, math has improved, less anxiety, and only one adjustment. That is within 2 months. His ATE scores. See how the scores went down, and speech, social function, sensory, health, and total numbers, which we'll show you. Look how things went down. 1 adjustment. Age 9.5, another doctor uses patients for years. 7 weeks, a lot calmer, less anxiety, more articulate, better schoolwork, better facial color, more energy in the past. He lost his adjustment, and he was more angry and anxious. After a second adjustment, he was calmer and less anxiety. Remember, when you do the same thing over again, you get the same results. That is more indicative of better research. All right, their scores went down. All right, 9-year-old boy, 7 weeks, lost his adjustment once. At that time, he was angry and constipated again. After we adjusted him, doing better, moving bowels better, no stomach distress, he was adjusted twice. He was Dr. Houston's patient for 5.5 years. What a history. And he showed improvement after we started adjustment, after 5.5 years. There's his scores. Scores went down. 10 out of 11 cases had traumatic birth injuries. We were told this by a woman that's keeping these statistics associated with Dr. Houston's office. All the autistic children held their first adjustment on the first 4 visits. They had to be readjusted at a later time. Remember, these autistic children are also banging their heads, and it was hard to x-ray them to begin with. Very hard. One of us, my associate and myself, Dr. Young Chung, had to be in the room sometimes to x-ray these children. We made a table out of the x-ray chair and laid them down on the table in some cases. The earpieces were generally 2 inches. We made them 4 inches to hold their head on center.